Good morning. You're listening to Trend Radio, where we talk about what's hot and what's not. Get into the loop with us. I'm Anthony Vincent.
And I'm Elise. And we're your radio gateway to what's trending with beauty, fashion, music, health, and wellness.
Elise, our guest today is Dr. Deborah Keegan.
Yes, it is. Can't wait to see her.
Yeah, Dr. Keegan is a native New Yorker who is a #1 fertility doctor right here in our own backyard.
She's amazing, and her specialty is reproductive endocrinology and infertility.
And she's going to be speaking with us very, very soon.
I can't wait, and she's so cute, too.
Absolutely. But first, our show is sponsored today by...
Us. Anthony Vincent Salon.
Anthony Vincent Salon. You reading the commercial?
I'm going to read it.
All right.
I'm going to read it.
Go right ahead.
Okay, here we go. At Anthony Vincent Salon, we take beauty very seriously. Our New York and internationally trained stylists are experts in the art of precision haircutting, European color, sizzling highlights, flawless makeup, fuller lashes, hair extensions, impeccable nails, and body waxing from head to toe. If you're planning a wedding, a mitzvah, 25th anniversary, or any special occasion, if it's special to you, it's special to us. We're proud to introduce Beauty Camp, where we nourish your spirit from the inside out, top to bottom, and all the way around. Our philosophy is to zero in on your beautiful transformation. We will give you an energetic look that defines beauty, vibrance, and sex appeal. You'll look good, feel good, and give a gift to those who love you.
For the 150,000 hairs on your head, there's only one choice.
Anthony Vincent Salon, for a more beautiful you.
Call us now at 609-448-2212. That's 609-448-2212. You'll be glad you did.
Yes, you will be.
All right. Well, what do we have today?
I have a tidbit for you.
Tell me all about it.
Okay. So first of all, this is a little weird. Okay. I had this dream the other night. You were in it, which I have to be honest, guys, I don't know why.
Do you dream, Elise, do you dream in color or black and white?
I pretty much dream in color. Sometimes black and white. Sometimes there's a pop of color. Well, I'm going to tell you, there was a pop of color with this one.
Was it Technicolor?
Listen to me.
I'm listening.
Just let me tell you my dream, okay?
All right.
All right. It's really important. It's got important message.
Everything you say is important.
Absolutely it is. But anyway, this is very important. You asked me to help you put glasses filled with water all over the salon and in the glasses with water. I have no idea why you asked me to do this, and I can't imagine why you want these glasses all over the salon, but it's got me thinking about hydration, and hydration is so important because weren't you just telling me the other day that it's so important to keep your body hydrated because your body is made up of how much?
85% water.
Right. You said that the other day. Anyway,
and it's also important to hydrate your hair also.
Yeah, it's important to hydrate everything.
Yes.
You know, we need water. But anyway, aside from that, so I was thinking, even though it's a little chilly outside right now, you know, sometimes I don't always want to drink my cold water.
Right.
You could have it hot. It doesn't matter. You could have it tepid, lukewarm, whatever. But anyway, you can actually hydrate, like I said, with hot or cold water, and you can have lemon or lime in it, hot or cold. But listen to this. Be creative with it. You could have ginger, or imagine hot cranberry water or hot grapefruit water.
Wow, that sounds delicious.
Right?
Absolutely.
I thought that was a really good one.
It
I thought that
absolutely
was
is.
great.
Now, you know, speaking of hot and cool, you know, cooling it on the hot drinks could be very, very increasing.
A hot latte. I feel like that's just my opinion. But anyway, I don't know. I like water, so it doesn't really matter, but I really don't like it very cold. But anyway, so a little kid came into the salon the other day, okay, and she had gum in her hair.
Right.
Yeah. So the mom's like freaking out, and somebody went to go, you know, oh, you can do it with ice, you can do it with this, but there's even a better thing to get gum out of your hair.
Scissors?
Yeah, no. You don't want to cut somebody's hair. The kid's hair.
I'm always thinking about cutting someone's hair.
Okay,
that's what I do.
The little girl had hair halfway down her back, and the gum was like near her ear.
Uh-oh.
Okay? You don't want to give her a pixie. I mean, as a little girl, even though it's very in right now to have a little pixie.
Pixies are in.
We'll talk about pixie later.
Alrighty.
The gum and the hair thing, get it out with peanut butter. And listen to me, the crunchy peanut butter, even better. You want to know why?
Tell me.
You don't know?
I know.
Okay, come on, you say it.
All right. Well, the ground up peanuts actually exfoliates the shaft of the hair.
Yes, and the oils help separate the hair from the gum.
Yes, so there's no stress to the hair shaft whatsoever.
I know. And that's what makes it fabulous. Because, ice really does remove it also. But the ice, can freeze the hair. Depending on the hair condition, not so great.
Right.
But the peanut butter, and then you eat a banana afterwards and you're happy.
You just make sure there's no hair on that peanut butter that you're spreading on your banana.
Well, yeah, I imagine that could be a little rough.
Absolutely.
Yeah.
What did Soupy Sales once say on TV? I think it got him thrown off.
What? Tell me.
He was somebody brought him some pies, and he talked about the apple pie, but the young lady that brought him a banana cream pie, he made a comment that she sure could make his banana cream. And they threw him off the air.
Oh my God!
Do you remember that? You were
no.
just a little girl.
No, I have to be honest. I don't remember
Soupy
that.
Sales, a true story.
Yeah.
Absolutely.
Ooh, you can make my banana cream.
Yeah.
Nice.
I think he was talking about the pie.
I'm sure he. Well,
I
I don't know about what he was talking about. You know what? We were not in his head. We do not know what he was talking about.
That's true.
And we do not know what this girl looked like. I mean, she might have been absolutely gorgeous, and she might have just turned him on.
Or she could have been a 200-pound yenta with a mustache.
I don't think that. I don't know. You know what? I wasn't there, so I'm not even going to comment on it. But anyway, I have a good one for you. I have a little tidbit for you. Another one.
Okay.
Because I'm just full of tidbits today.
All right, I'm listening.
Do you like ketchup?
I love ketchup.
Do you?
I put it on everything.
Do you really?
Well, my French fries and my hamburgers.
Do you put it on your eggs too?
No, I do not.
Oh, good, because I just can't stand when people put it on their eggs.
Or their steak. What a
Oh my
ruining
God!
a
Oh my God!
good steak.
I know somebody who does, who puts ketchup on his steak. It freaks me out.
I
Why
hate
would
that.
you do that?
I have no idea.
I have no idea either. But anyway, listen to this. In the 1830s, okay, I know it was a very long time ago, and I know you were just a little boy then.
I was just a little boy back then.
But it was sold as medicine. Medicine. Ketchup was the medicine in the 1800s. And I know why, I'm sure, because it's very high in lycopene and it's very, very good for you. It's got a lot of antioxidants, from the tomato.
Absolutely.
But imagine if today that stood, it came through. Imagine how inexpensive medication would be if it was ketchup. Ketchup. Because, you wouldn't just put it on your steak.
No.
You would take care of your sore throat, too, with the ketchup.
Well, what's interesting about medicine, a pharmacist back in, I guess it was the early 1900s, actually invented Coca-Cola. And what he did is he used the extract of the coca leaf to put into his cola drink. And it was the rage. People were drinking it, and it's all they wanted. Coca-Cola. What happened was it was cocaine and people got addicted to the to the beverage, and it did very, very well. And then in 1925 they took the coca out of the Coca-Cola.
Yeah. It's a really shame that Coca-Cola actually takes the paint off of cars, and does so much damage to people's stomachs, puffs their stomachs right out and stuff like that.
Yeah, but it tastes
it's so
good.
good. I know, it's really delicious.
Watch what you say. I don't want Coke to come after us.
Yeah. Oh, yeah, of course not.
I love Coca-Cola.
I do too. We don't have to promote them. They promote themselves
Things go
beautifully.
better with Coke.
Actually, I like a Diet Coke. I sometimes crave a Diet Coke. Yeah, I love it. Yeah, I love the caffeine, I'll be honest with you. And just that bite when you drink soda. I don't really drink it. I just drink my water with lime.
Yes.
Or my fruity drinks and stuff like that. But I don't know. I absolutely love it. Can't say enough about it. Anyway, so that the first electronic computer was called an ENIAC. Okay, and it was produced in 1946. Did you know that?
I did not know that.
Okay, it was huge. It was 78 feet long and 8 feet tall. Now, where on earth could you possibly put this thing? Do you know that if the geniuses who smashed the computers into palm-sized devices hadn't done that, do you know we'd all have to live in mansions in order to have a computer? Seriously.
I thought you lived in a mansion now.
Hey, you know what? It's about your perception of what a mansion is, but that's not the point. We'd all have to live in really, 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 really huge houses in order to accommodate that really, 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 really huge computer.
My mansion is any place where I'm loved. That's a
Oh,
mention.
now that's a nice thing to say.
Well, it's
Are
the
you
truth.
loved?
I am loved.
Do you think so?
I Yes, I do think so.
Do you?
I do.
Well, I love you. So, I
Ah.
mean, I know that. So, you're in a mansion right now. So, that's a good thing. And I have one more little tidbit that I have to share.
Please
Okay.
share.
And I'm kind of like freaked out about it because, like, what is up with this one? Listen to this. Early on in the Olympic Games, did you know that women were not allowed to watch, but they were allowed to participate? What is up with that? What? Tell me.
Well, I guess. Oh no, I can't even say that.
Don't say
No, I'm
anything
not.
bad,
Nothing.
okay? Because women
I
are what
love
makes
women.
your world go round.
Yes, they do.
So, what
Yes.
is up with that? Tell me. Explain it.
I
That was a
cannot-
man who decided that.
It was a man, and it was probably a chauvinist pig to boot.
I'm sure. I'm sure. We know that you're not a chauvinist pig, though.
Absolutely not. Absolutely
Okay, you
not.
know what? I want to just tell you, we have another commercial. If you want to read it, you can, but I think I sound better reading this one.
Alrighty.
All right, then.
Okay.
So, here we go. Anthony Vincent Salon has been proudly serving Central Jersey for over 30 years. Our staff is dedicated to providing prompt, professional, and friendly service in a warm, inviting environment. Anthony Vincent himself, who's sitting right next to me, by the way, is an accomplished salon owner and master stylist known as the Wizard of Weddings. Why should the stars be the only ones to have a team of stylists? Trust his internationally trained New York stylists to give your hair and nails more of what they need. The Bridal Beauty Camp program, created by Anthony, offers a fun and healthy total beautification for your big day. Brides and their bridal parties get into shape from head to toe with nutritional guidance and toning and firming techniques so everyone looks great as they walk down the aisle. Brides-to-be are pampered, so they're confident that they look absolutely beautiful. Anthony Vincent Salon stays in touch with the latest techniques and styling trends for your perfect look. Located on Route 130 in East Windsor, just minutes from Route 1 and right off the Jersey Turnpike. Choose Anthony Vincent Salon.
For a more beautiful you. For the 150,000 hairs on your head, there's only one choice. Anthony Vincent Salon. Call us now. You'll be glad you did. Okay, we will be right back. Again, you are listening to Trend Radio, where we talk about what's hot and what's not. Get into the loop with us every Saturday morning at 10 a.m. I'm Anthony Vincent of Anthony Vincent Salon. Time for another fun and fabulous beauty tip with our tip chick. And here she is.
Got limp locks? Wake that dead, lifeless hair. Use the right bodybuilding products. Texturize, and what a surprise. Say hello to beautiful.
Want your beauty question answered on the air? Email us now from anthonyvincentsalon.com. Remember, for the 150,000 hairs on your head, there's only one choice. Call us now at 609-448-2212. You'll be glad you did.
And we're back, and you're listening to Trend Radio.
Where we talk about what's hot and what's not. Get into the loop with us. I'm Anthony Vincent.
And I'm Elise, and we're your radio gateway to what's trending with beauty, fashion, music, health, and wellness. And you know what we're here to talk about right now?
We are going to talk about thinning hair.
It's part of our beauty tips.
Absolutely. Now, do you realize that thinning hair is very, very common in 78% of Americans?
I do realize this. I'm one of those.
You,
Not that my hair is actually thinning, it's just thin.
and there are many things that you can use
Well,
to
tell me.
plump up the hair.
Tell me what you can do to plump my hair.
Well, you're going to have to come into the salon. And
I think that's easy for me.
absolutely.
I think I'm doing half those things anyway.
Yes,
my
you
hair
are.
actually doesn't really look thin. I just know that it is.
Well, that's because you are using
What you tell me
what
to
I tell you to
use.
use, the products and the treatments
That is
I
correct.
tell you to give. In fact, I encourage you and other clients to use our in-salon treatments.
Don't you
and-
love that? Encourage.
Yes. These treatments will exfoliate the scalp and have anti-aging properties to promote healthy
And we
hair
all
growth.
love that, don't we, ladies?
Yes, yes.
Anti-aging. Huge. Right?
Absolutely.
I love it.
So, anyway, let's get back to...
Well, wait. I want to talk about the hair a little bit more.
All right, let's absolutely do that.
You know why? Because here's the thing. When your hair is thin and fine, aside from using the products, which are amazing, and I know that you encourage that.
They really do plump up the hair
Yes.
and make it appear.
I know. You know, we
thicker.
said plump 3 times in the past couple of
I
minutes.
love that
Are
word,
you saying that I'm plump?
No, your hair is.
My hair is plump. Okay. Ooh, I just said it again. All right. You know what? Here's a little quick fix for you, though. Ladies and gentlemen, because I don't want to leave anybody out. I know everybody has this issue with the hair. I myself included, so, we're all there. But here's something that you can do. First of all, you can change your part. Okay? Instead of parting it to one side, part to the other side. Instead of parting it in the middle, go choose a side, because sometimes that really does make a difference. And just changing that can boost body and volume.
Absolutely
Another
will.
thing, and I know, I do that. I absolutely do that. Another thing that you can do is, and this is just a fun one, turn your head upside down, brush, do a little mist of spray, and turn it back. And you'll be surprised. I mean, you've got some rockin' volume there.
Not only a spray, but you can use a very light wax on your hair, running it through from scalp
Yes,
to
you
halfway
can.
down the shaft of the hair.
Yeah.
Scrunch, crunch, flip it back, super volume
Okay, and
and fullness.
absolutely. I was going to say, that's exactly what I was going to say.
I know.
And fullness. You got to stop stealing my words. Stay out of my head. I mean, come on. All right, go on. You have something else for me?
I do.
Tell me.
What we are seeing in the salon are a lot of are uncoiled curls. Now,
I
that.
love that. I can't do that.
Yeah.
Yeah,
I'm talking
wait.
about for really frizzy hair. What I'm seeing a lot of is that curly hair can be very, very difficult to tame. And rather than going from ringlets to a really straight look, it's natural is really natural movement is in right now. And by curling the hair with a curling iron and loosening and just creating soft waves is a very, very beautiful look and a nice change from going to either to really curly or really straight.
Yeah, I like that. Actually, what's really hot with the long hair, especially when your hair is a little difficult, is just exactly what you just said, but also that disheveled, soft, romantic look. That's always lovely.
Always.
I always like that.
And the what's becoming very romantic is ombre, and I'm not talking about.
Ombre is romantic.
Yes, it is. The soft color change from mid shaft of the hair down to the ends, but something that we're seeing a lot of is extreme ombre.
Yes.
Yes, it is.
Yes.
Though.
We're doing a lot of that in the salon.
Now, and the ombre color is not fading anytime soon. In fact, what we seem to be doing now is no longer a subtle lightening, but an actual dramatic lightening of the ends and a more dramatic progression starting from, again, mid-length down to the ends.
I love this.
Yeah, a gradient look from natural to very, very blonde.
Speaking of this, what's really nice about this is, I mean, of course, the ombre, it's very high fashion, very nice, very awesome look, really intense, beautiful, dramatic, like you said, and also romantic, of course. But speaking of color, what's great about the ombre is that you don't really have to have your color done as often. Like somebody like me who does not have ombre and who has a few, shall I say, colored little strands that pop out of my head that I do want to have colored. Like I can't always get it touched up because sometimes there's not time when I need my roots done, but there's a way to camouflage that. Do you know what that way is?
Tell me. I'm
You don't
sure
know?
you're about to.
You don't know?
Oh.
I know you know. I know you know.
Are you talking about a zigzag part?
I am.
Of course.
I am. I think it's so cute.
It is. It
It's
is
really
cute.
so cute, and it really does help hide some of the other colors that you don't really like popping up.
The other thing you could do too, if you have a little difficulty getting those zigzags, if you're left-handed or right-handed or totally unambidextrous, you can just change the side of the part, go from left to right. That'll also give you a little more volume, a little more fullness.
Yeah, and you can tease it a little bit also, and then it'll kind of hide your little root issue.
Absolutely.
I mean, I think that It works for me sometimes, not all the time, but it does work for me.
You know what I'm liking? We just trimmed your hair the other day, and we did a little something with MIDI bangs.
Oh my God, I know. I love them.
Absolutely.
They're so cute. I love them, and they're so hot right now.
Yes, they are.
Nothing like a little fringe to frame your face.
That's right. And we're not talking about the fringe trimmed on your handbag there.
Or my boots. You know my boots with the fringe?
Yeah, I really like those.
Aren't they cute?
Yes, they are.
I love them.
So
Yeah.
what we did with Elise is we trimmed those bangs long, and we kind of swept them off a little bit to the side, and we got a little small paddle brush. We blew them down with a flat iron, kind of coaxed them down, around, and into one direction.
And I love it.
And you look fabulous.
Oh, thank you.
Absolutely.
Thank you. Thank you so much, Mr. Anthony Vincent.
My pleasure. It's what I do.
It's what you do. Do what you do. Anyway, I have another little beauty tip for you.
I'm waiting.
Okay. You know how awful it is when you get mascara on your eyelid?
Actually, I don't.
Well, it's really awful because, first of all, you're putting on makeup. And even if you're not wearing eyeshadow, you're wearing mascara to just, enhance your eyelashes. And there you go. You have clumps of mascara on your eyelid. Well, ladies, here's a little trick. Do not, I repeat, do not lower your chin. Don't lower your chin, and then you won't have the little black speckly spots on your eyelid.
Keep your chin high and your chest out.
Oh, yeah, that's what they say.
Yeah.
Yeah, they say that at the military. They say that, and my mother used to say that to me growing up. It's a confidence thing.
Absolutely is.
Yeah.
But getting back to your eyes, treat them very, very gently. When you cleanse them, blot dry.
Absolutely.
Never rub.
The skin is very fragile around your eyes.
Very thin.
You do not want more wrinkles or any wrinkles.
None.
See,
And
I do it very gently. You can tell.
when you moisturize, dab the moisturizer on, and always dab in an upward motion.
Okay, I will remember that. I will absolutely remember that. And you know what? I have something for you also to make your eyes look bigger and brighter.
My eyes looking bigger and brighter?
Well, if you want to wear makeup.
I'm okay with that, but thank you.
Okay, well, I wasn't speaking to just you.
Okay.
Even though you seem to think that when I speak, it's just to you. It's, yeah.
Well,
it's
we're the only two here.
Yeah, well.
And along with Wade, our
Yeah, I was
producer
about to
here.
just say that. I was about to say, we
Say
do
hi,
have-
Wade.
Thank you.
Great to have you, sir.
Thank you for acknowledging I'm a person.
Yes, I always do. You always get a good hug and a kiss from me.
Yes, you do.
But anyway, let's brighten your eyes, okay? First of all, and make them look bigger. If you put white eyeliner just in the lower rim of your eyes, it will make your eyes look so much bigger. And just brightening them with a little bit of shimmer right on the top of your eyelid, and then in the corners, it's amazing. It's absolutely amazing. And it really does make a difference. Look at a picture of yourself with the white eyeliner and look at a picture of yourself with dark eyeliner. You will see an absolutely huge difference. I did it. I tried it. It was amazing. And you know how my eyes are a little almond shaped, so they tend to look a little small.
Oh,
well,
at least you have beautiful eyes.
Well, thank
and
you,
And
but-
the almond-shaped eyes, I think, are the most beautifully shaped eyes.
Oh, well, thank you. But that's not what I was getting at. They are a little small looking sometimes, and they get squinty looking sometimes. And I know that there are some of you out there that have the same little issue. Try the white eyeliner. It's amazing. Really works.
I hear a lot of women and see a lot of women wearing these bold red lips
Well, you see me wearing them.
all the time. And I love big, bold red lips. What can a gal do to make it so that the color will last and it doesn't fade or crack?
I will tell you what I do because my lips, honestly, ladies, my lipstick always stays on no matter what kind I use, from the very, very expensive to the very, very inexpensive. I use it all. Anyway, first thing, and this is very important, you must exfoliate your lips. Really take good care of them. And you must moisturize your lips because the dead skin happens. I mean, you can't help that. Take it off, sugar scrub, salt scrub, whatever you want to do. I mean, the salt can be a little burny sometimes and create a little bit of redness, so you want to do it at night before you sleep. Moisturize your lips, keep them moist. But before you do anything, you can there's a couple of different ways you can do this. You can put a little foundation on, a little powder on your lips first, and then carefully line your lips with your lipstick. Preferably a matte lipstick would work at first. Do your lips, fill them in, and smile as you're applying your lipstick. It'll really make a very big difference as far as getting the corners covered and that kind of thing. But besides that, then you're going to blot them with a tissue. Add a little powder and reapply your lipstick. Amazing. It will be lasting. It will stay. They will be bold and beautiful. You can dust a little powder on top again and even add a shimmer if you'd like. And another thing, if you want to really give them that fullness, add a little shimmery powder or shadow or blush just to the center of your lips on the top and the bottom. Oh my God, they will be plump. That seems to be the word for today, plump.
We love that plump word, yes.
Especially when it comes to lips.
Yes. Now, while we're on the subject of lips, now, we're seeing a lot of dramatically colored clothes. And can you wear red with these colors, or can you use other different colors?
Something that I actually do is you'll see me a lot also wearing a bold, bright red lip, and I'll be wearing a burgundy shirt, a wine-colored shirt. Or I might even be wearing, something on the reddish orange, which is actually a little odd for me, believe it or not, or even a purple, and I'll go with, a different hued shade lip. You can actually mix and match. That's really actually pretty hot right now. You can mix and match. You can go with the reds and the wines, and it kind of really just goes with everything as long as it goes with your skin tone. That's what's important, to match your skin tone. What do you think about that?
I think that matching that skin tone with your lips, beautiful. And what about adjusting the makeup for a smoky eye?
Okay. Well, they're actually showing that you can do a bold lip and a smoky eye. Not my favorite thing to do, but you actually can do it. But you want to just take it down a notch because you don't want to have the boldest lip and the boldest eye. So take it down a notch. You can go a little nude on the lip.
Thank you, Elise. That was great.
Thanks. You're
and
welcome.
We're soon going to be with Dr. Keegan. But
Who
first,
we're so excited about.
Yes, we are. It's going to be a great show. But first, let's talk about Anthony Vincent Salon.
Absolutely.
Are you planning your wedding? Treat yourself to beautiful. Trust your hair in our hands. Being beautiful isn't always easy, but my staff and I make it simple for you. Let us show you the way to flawless makeup, long, luscious lashes, and impeccable nails. Reveal the beautiful in you. For the 150,000 hairs on your head, there's only one choice. Anthony Vincent Salon. For a more beautiful you. I'm Anthony Vincent of Anthony Vincent Salon. Time for another fun and fabulous beauty tip with our tip chick. And here she is.
Got dry and brittle? Squeeze a little protein pomade into that parched mane. Say hello to beautiful.
Want your beauty question answered on the air? Email us now from anthonyvincentsalon.com. Remember, for the 150,000 hairs on your head, there's only one choice. Call us now at 609-448-2212. You'll be glad you did. And we are back with our guest of honor today, Dr. Deborah Keegan. Dr. Keegan of the Institute for Reproductive Medicine and Science, U.S. Highway 130, 375 U.S. Highway 130 in East Windsor, New Jersey, 609-448-4300. Dr. Keegan, a native New Yorker and a #1 fertility doctor, is right here in our own backyard.
And we are so lucky to have her. So lucky.
Dr. Keegan, it's so nice to see you today. How are you doing today?
I am great. Thank you for
Fabulous.
having me, Anthony and Elise.
It is
We are
wonderful.
thrilled.
Absolutely.
It's our pleasure.
All
Really?
mine.
No, it's ours too, really. And you know what? The pleasure of everyone who's going to be able to hear everything that you say, because you have a lot of wonderful information that people really actually do need.
I agree. Let's do it.
Let's do this.
Terrific.
Okay.
Why don't we start off by first letting us know what is infertility?
Well, if you want a technical definition, infertility is the inability to conceive despite having either 12 months of unprotected intercourse if you're under 35, or 6 months if you're over 35. But basically, what one would think infertility is, which is the inability to be fertile or conceive, have a baby.
Is that a very common problem?
It actually is. It has become more common over the last several years, which is why people like us are in business, and you'll see, there are practices like us all over the place. In the United States, there are about, I would say, 1,000 board-certified reproductive endocrinologists and infertility specialists, and we see a rate of about 1 in 6 to 1 in 8 infertile couples in this country.
Wow.
Now, is it just the woman that could be infertile?
Oh, absolutely not. So usually what I tell patients is that 30 to 40% of the time, the problem lies with the female, 30 to 40% of the time, the problem lies with the male, and the remainder are combined or unexplained cases where we really can't identify what is wrong or why the couple can't conceive by the workup that we can do, the evaluation.
In a lot of movies, we see funny things about timing and I'm at my peak. Put your legs up in the air.
Yeah, hurry up. I'm coming home on my lunch hour.
Movies love fertility and pregnancy, don't they?
Yes,
yeah,
they do.
yeah. No, but they'll make the phone call. It's time.
There's a lot of material there.
What do you mean you're in a meeting? I'm coming to you. I'm coming to your office. And yeah, it's hilarious.
And we're going to go into the men's room.
Yeah. Are we really?
Well, you can have sex in a men's room.
Would you really?
You can't
do
have
that?
sex in a ladies' room.
Would you actually take somebody into the men's room and have sex with them?
No.
Because that would be horrible.
Maybe the Westin or the W,
Right, it
but not
depends.
the
It
men's.
depends on the label.
Oh my gosh. That's just terrible. All right, let me ask a question now, okay? You're just hogging the questions
But
here.
wait, I will say this is true. Timing is everything. So what you are talking about are, those moments in the movies where, she either, for lack of a better word, right, pees on the stick. I'm sorry. That's
so it's actually-
so non-medical.
Doctors say pee?
Doctors do void. She voids on a stick.
Okay.
Which that hormone that we are looking for on an ovulation predictor kit is called luteinizing hormone. It's LH, and that is the signal that she is going to ovulate within the next couple days.
Okay, so it is key that
So
they
it is
actually...
key. Timing is everything. So we know the egg and the sperm have a limited lifespan once the egg is
All right.
released, and once the sperm is released, there definitely is a limited lifespan to both gametes. And so we like the egg to be there, and then the sperm to be there first, and the egg to drop. And that if that timing is correct, then you may get a conception. You don't always get conception, but you may.
Right.
Now, you said there's a limited time. What's that time?
The egg won't really live for more than 24 hours, and that might be a stretch.
Really?
And sperm, there are reports that sperm can live for up to a week, but
Wow.
probably a day or two, really. Yeah.
Yeah.
Can you freeze the eggs in the...
Oh, that's such a great question, Anthony. You fell right into my spell. Right under my spell.
I fell into your spell the evening we met.
I know.
Oh. Actually, I have to be honest, so did I.
I wish they could see us. They could go to the website for that, right?
Absolutely,
There's a picture there. So yes, we do have the capability to now freeze eggs. So for a long time, we've been freezing sperm for years and years.
Right.
It wasn't very hard to figure those guys out.
They show that in movies too.
Yes, they do. They're tiny little cells that are easily frozen, and there are sperm banks all over the world. And this is something that we were able to technically master many, many years ago. It's probably only within the last 10 years that we as a discipline, as scientists and physicians have gotten pretty good at freezing eggs. And the reason that is technically it's much more difficult because for a sperm sample, all you need is for a man to ejaculate and we can process the sperm. For women, you actually need to surgically extract the eggs after stimulation with medication. And then those egg cells are much, much bigger than sperm. And if you think about trying to freeze an actual egg, there's a lot of surface area. And so freezer burn would happen. And so now we have figured out how to overcome this.
Oh, that's wonderful.
It is.
That is absolutely wonderful. I love that. There's just so much going on also with you guys in everything that you guys do. You do so much to make sure that these little situations that are actually huge situations get taken care of, and that people can actually have children. It's amazing.
Right. Well, where,
You know?
where the egg freezing comes in, and which is so important, to us as a group, we are 6 women, is that first of all, it provides it provides reproductive autonomy that I don't think women ever had. So the egg freezing really started to come into play when women with cancer were being diagnosed in their reproductive years, and typically chemotherapy was gametotoxic. In other words, it would kill the egg cells because women are born with all the eggs we're ever going to have.
Right.
And so that chemotherapy is very toxic. So a lot of treatment for certain cancers was very toxic to these eggs that reside in the ovary and are there from the day we're born till the day, we are menopausal. So those women would have a lot of trouble conceiving after their chemotherapy, or they may have even been rendered sterile. So where egg freezing first came in was for women of reproductive age who knew they were going to undergo chemotherapy. We could then take their eggs and freeze them before the chemo. And because we have gotten so good at...
Isn't that wonderful?
It's phenomenal because women are surviving their cancers.
That is exactly.
Breast, leukemia, lymphoma. And these women are now coming back for their eggs, and they're actually getting
then
pregnant.
they're able to have a child and live a long,
That's
beautiful
right.
life.
Once their cancer is cured.
Isn't that just gives me chills?
It makes me feel good.
Of course.
It does.
Of course. Look what you do. You do an amazing thing for women, for people. I mean, for families. And think about the child that's born and what that child will end up doing.
Right.
A product of magic, really. Beautiful. That's amazing. So I'm going to actually bring us back a little bit before the freezing.
Sure.
And just ask you, what are some of the causes of infertility?
Well, we talked about female causes. We talked about male, or right, when the female is when the female is the cause or the male is the cause. So for women, one of the things is lack of ovulation. So we know that every month in a normally menstruating woman, she in her reproductive years will release an egg about mid cycle, and when that egg is released, it is susceptible to fertilization. So some women have hormonal imbalances per se, and they don't release an egg every month. So that's one reason, because you need the egg in
Of
order
course, you
to
need
make
the
baby.
egg, right?
Another reason is tubal disease. So women...
Tubal?
Tubal. So
Tubal disease.
if you recall, Elise, maybe from high school biology, women have a cervix, a uterus, and attached to the uterus are 2 fallopian tubes.
Right.
And that is the pathway or the conduit from those ovaries, from where the egg is released, into the uterus. So the egg gets released from the ovary, and the fallopian tubes, they're on both sides of the uterus. They have little finger-like projections called fimbria, and those little fimbria, it's truly a fascinating organ.
No, yeah, it absolutely is.
But they pick up the egg that is released into basically the pelvic cavity, and that egg gets swept into the tube, and the sperm actually fertilizes the egg in the tube. So a lot of people don't realize that, and I talk about this a lot in my consultations. If a woman has had an infection, some kind of pelvic infection, possibly a sexually transmitted disease, gonorrhea, chlamydia.
We hear about that a lot.
Even HPV is a sexually transmitted disease. The tubes are at risk for damage. And if those tubes are scarred or damaged in any way, the egg won't successfully get into that tube, or perhaps not be successfully fertilized and then move down into the uterus where it implants to grow. So tubal disease is a big one, especially for women that have had a history of a pelvic infection or even prior surgery. You can have an appendectomy, say you had a ruptured appendix. Well, all these organs kind of share the same space, and if you get some bad scar tissue in the pelvis, you can affect the fallopian tubes. Another thing that can interfere with the tubes being able to move properly or the ovaries function is endometriosis, which I know I've actually heard a couple things about studies being done in our area for women with endometriosis. And that's a pretty complex disease in which, I guess to summarize, the lining of the uterus implants where it's not supposed to. So out on the ovaries, in the lining of the pelvic cavity, the tubes, the uterus, and it just wreaks havoc because basically it's like bleeding a little bit into your pelvis every month, and it causes scar tissue. It causes infertility. And so that's another thing that we look out for. Yeah.
Now, does poor diet, being overweight, being underweight, alcohol? I know you talked about some of the, sexually transmitted diseases.
Yep.
Do those things have any effect on?
As far as alcohol will interfere with your good judgment, right? And having unprotected intercourse. So that's a very good question. And that is true. Yes, obesity. So being obese and being severely underweight, both of those things can affect a woman's ability to ovulate. And we just know also that metabolically, those two situations can affect the body in terms of, hormones, preparation for pregnancy, the ability to carry a pregnancy. Kind of like, also at a biomolecular level. But certainly we recommend women that are overweight to lose weight and women that are severely underweight to gain weight.
Well, you want to be, healthy.
You want to be
wanna
healthy for
at
pregnancy.
for anything really, but you want to be at an optimum level of health to, get pregnant.
Absolutely. So let's keep it right here. We are talking with Dr. Deborah Keegan, our guest of honor. Dr. Keegan of the Institute for Reproductive Medicine and Science at 375 U.S. Highway 130 in East Windsor. If you have any questions, you can call her office directly at 609-448-4300. That's 609-448-4300. Okay, Dr. Keegan, thank you. We're back again. Elise.
Yes, we are. And now I have another question.
Of course you do.
Of course I do. Of course I do. How could I not? That's all I do is I ask questions and I talk, whatever.
She has 87 questions to be exact.
I really don't have that many. Yes, I do.
Of course.
She does her homework.
Yes, she
we know.
does.
We know.
Well, it's important. It's important to
And
do
this
that.
is interesting stuff.
I think so. And it's very important that people know.
I
that,
agree.
People have to be in the know so that they can. Knowledge is power. Let's face it. Okay. What is in vitro fertilization?
My career. So in vitro fertilization
Wonderful.
is one of the ways in which we can help a couple establish pregnancy. Very technical. It is the process by which we stimulate a woman's ovaries to basically grow more eggs than that one I told you about gets released every month.
Right.
So just sort of for those listeners that are kind of interested in knowing how this works, the way I like to explain it is that every month in a natural cycle, there's a bunch of little eggs that would like to grow. But the human body has a way of squashing a bunch of them so that one wins. Squashing.
Love this.
That's very technical terms here.
Again, the medical terms,
I love it.
So I went to a pretty good med school too. They'd be so
You know
proud
what?
right now.
You are so informed, and I love this. I love everything that you're saying, and I'm learning so much. I know other people will be learning.
Oh,
You're
absolutely.
learning, aren't you?
I'm learning. I never knew so much about a woman till today.
Oh, wow. This is
And
perfect.
I thought I knew everything.
I'll
is
stick
something
around
he
after
really-
the show and tell you more.
This is what he needs.
So every month it's just one, right? Because humans we're not dogs and cats. We don't have litters. If we released 6 eggs at a time, there could be trouble. So what IVF does, what the stimulation medication does, is it really rescues those other eggs that are sitting there that month or in that cycle, so that we can hopefully retrieve surgically more than one. The goal is to get a pick, because human reproduction is very inefficient. Not all eggs are good. So we want to get as many as we can to increase the chance that we have fertilization with sperm, and then growth and development of the embryos that will then correspond to an implantation and a future pregnancy.
So let me ask you then, if that's what happens, and you have a bunch of eggs then, okay? I know this is not going to sound as technical as it should, or as
We're not being very technical,
okay,
right?
So I guess that's kind of how women have twins, triplets, 5 babies, the octomom, that kind of thing.
Right.
Is that what happens?
No, that's a very good question, Elise. In vitro fertilization, you have the ability to only replace one embryo when you actually do the embryo transfer.
Okay.
So once the eggs come out, they then are it's a really cool process. I wish you guys could see. Maybe we could post some video or something at some point. But
Okay.
we do a transvaginal ultrasound guided oocyte retrieval or aspiration. So there's a needle that actually goes into the ovary, and using negative pressure, we apply negative pressure, the fluid around the egg is removed, and with that, the cell eventually detaches and comes out in the fluid. Those little tubes are handed right off to an embryologist, and at IRMS, I want to plug them and say we have probably the most skilled embryologists in the country. I get to say that. And
Yes, you do.
They look at the eggs, they count the eggs, and then later that day they will fertilize them. And then, there are 2 different ways to fertilize them. If you guys want to get technical, we can talk about that. But the next day the patient is told how many have fertilized. Based on her age and her history and her diagnosis, we, the physicians, together with the embryologist, determine what the right number to replace, the appropriate number of embryos to replace at the embryo transfer, which is actually a very simple procedure and does not require anesthesia like the retrieval. That number at IRMS is really 1. We are we're huge proponents of single embryo transfer because we know that twins and triplets and quadruplets is not something we want to create or promote. And we spend an awful lot of time educating our patients about why twins are not a good idea. So if someone is coming through their first cycle, if she's young, and young for us is less than 40, tubal factor, perhaps even just a male factor, they are counseled from the first consultation that they will receive 1 embryo at their transfer. If I can go on,
of course, please.
The triplets and the quadruplets and what you've alluded to, that happens with a different procedure that we also use, which is just doing an artificial insemination.
Okay.
All
Now,
right.
artificial insemination, that's not, again, you see this in the movies, a turkey baster and,
It's a very tiny turkey baster.
Okay.
Right. It's
Okay.
it's a tiny little syringe that actually, well, it's so great for jokes and movies, right?
He's great, yeah.
So yes, similarly, the female is stimulated usually with medication that can help us, increase the chance that she's pregnant either by inducing ovulation because she doesn't ovulate on her own, or just increasing the chances by, getting a couple extra eggs that month.
Now, what is the success rate?
Well, again, it's a good question, and it all depends really on age, diagnosis, prior history. But you can take someone who, say, if they haven't been able to successfully conceive in 2 years, just say a healthy 35-year-old couple, their chance of conceiving each month now drops to about 3%. If you take that same couple and you put them through IVF, you can give them pregnancy rate that month of 50%. If they do an insemination, depending on how you treat for the stimulation of the ovaries, you can get that to about 15% or so.
Now, is there a negative side effect to these treatments?
When we talk to patients about the side effects, we talk about the side effects of administering the drug. So they're injections, right? So you have to inject yourself every day, and if you are pregnant, you may continue injecting yourself for 4 more weeks after you're pregnant.
Where do you inject yourself?
They're subcutaneous injections, so they're really tiny little 1/2-inch needles, and most patients will inject themselves right in the abdomen, right in the belly.
Even if they find out that they're pregnant, and then they would continue to...
Those little injections are the ones that stimulate the eggs to grow.
Okay.
And then after the eggs come out and we put the embryos back in, or embryo, we switch to a different hormonal injection that helps support early pregnancy.
Wow.
Mm-hmm. And that one actually is an intramuscular. It's a deeper one, and it goes in the buttock. They don't really like that.
Yeah.
How costly are these treatments?
Well, good question. In New Jersey, we are what is considered a mandated state. So insurance carriers in New Jersey will provide some form of fertility coverage. A lot of people don't have that too.
That was my next question. Also,
Yeah.
by the
So
way.
I was actually
it
gonna
depends.
ask it.
Of course you were.
I was gonna knock
It's
you
very
out.
mixed, and we figure that we have a wonderful financial and business division that vets your insurance before you come in, so you know exactly what you're in for. But if you were going to pay for, say, an IVF cycle straight out of pocket, you're paying for medications, you're paying for anesthesia fees, you're paying for lab draws and ultrasounds and all that stuff. It's pretty pricey, and it will, it could go between $10,000 and $15,000 easily.
But well worth it. If the success,
Truthfully though, if you have the money for it, honestly, I mean, it's always well worth it. I mean, you get,
absolutely.
look what you get.
Yeah, absolutely.
No
Well-
one's ever returned a baby because they were too expensive. I would just like to say that.
I've never
Regarding
returned
the
mine,
price.
and they were.
Good answer. Good answer.
They are.
Well, ladies and gentlemen, if you just tuned in, we are talking with Dr. Deborah Keegan. Dr. Keegan is from the Institute of Reproductive Medicine and Science at 375 U.S. Highway 130 in East Windsor. You can reach her at 609-448-4300. That's 609-448-4300. All right, and we're back with Dr. Keegan.
Okay, and we were just discussing the cost.
Yes.
And insurance and all of that.
Yeah.
Let's continue with that because that's really
Yeah,
important, I think.
Absolutely. Are with the cost being a little pricey, are there clinical trials or anything like that?
There are.
There are.
I wouldn't exactly call it a clinical trial. There are research protocols that patients can participate in when we have them ongoing. I just wanted to back up and add one thing that in our practice, because we are in New Jersey, and I was told by a little birdie over here that 90% of our patients are covered for some or all of their treatment.
Oh, that's
So-
awesome.
Wow.
Yeah.
See, that's wonderful to hear.
So that's the importance of, when you come to see us, it's the entire package, right? Before you even step through the door, like I said, your insurance policy is vetted by our business office so that we can tell you before you show up to see the doctor.
See, that's wonderful.
Yeah.
That's wonderful to know this. And I'm actually going to share this. I have a client currently who she's just having an awful time. She really is. And she loves her doctor. I mean, once you start with somebody, I kind of think that, you build up a trust factor and they have a good rapport, but it's just not working for her.
Right.
And so I'm going to definitely give her your name and your information because I think you'd click. And she's just having an awful time right now, and it's pitiful to see her. She's so sad.
It's patients are very sad, and it's a very difficult diagnosis to deal with. I mean, a lot of times I talk to my patients. We talk about and we chuckle about how much time we spend trying not to get pregnant, right?
Oh yeah,
as women,
I know that.
men as well. And then all of a sudden, you're sitting in my office in front of me, and by the time someone is gotten up the courage, right, or the nerve to even walk through our doors and sit in front of a fertility doctor, you already wanted that baby a long time ago. Then factor in the time it's going to take, to start the journey of infertility treatment. So, we understand it's a tough road. I mean,
it really must have such an impact on their psychological well-being.
I was just about to
Absolutely.
say that.
Of course you were.
Yeah.
It does, and we recognize that. We have an on-staff psychologist, and she,
that's wonderful.
Most of what she does is dealing with infertility. Couples grappling with infertility, and I think the fact that we also approach the patients individually, what do they need? How some of them come in and they say, I know what I want to do. And, is it possible to go right to IVF because this is what I need? And some of them just need to find out if anything's wrong and then go away for 6 months. But, you also need to very gently explain to the patient what you think would be in their best interest, because they all come mostly because they want a baby.
Of course.
Do you ever recommend alternative
I can't believe you.
treatments?
I was just going to say that.
I know that.
I know.
Still your question?
He did.
Or even holistic.
Oh, you did it again. Go.
I do. As a matter of fact, I work very closely with some acupuncturists. They're not employed by our practice or anything, but there are certain patients that I think benefit from.
Why acupuncture?
There have been some studies that have shown that it can be helpful.
Stimulating something?
That's their realm. We should get my friend on here and let her talk to you guys about that, because I think that would be good.
That would be wonderful.
Yeah, that would be a
we'll
great
talk about
thing.
that.
Very interested.
She
Absolutely.
would probably love to too. And I'm talking about someone that specifically I work with in our area. We all will work with different people in our
Sure.
areas that, the acupuncturists, they employ herbs. We often ask our patients not to take herbs while they're cycling or taking our medications, because we just don't know how they interact.
Of course.
How they can affect, the quality of the egg or even implantation. But sometimes just, to promote relaxation, certain things about Eastern medicine where they can, change sort of the blood flow and maybe perhaps alter the hormones a little bit. I have never studied Eastern medicine, so I cannot say, how it works exactly, but I do know that there are patients that benefit from it, and some studies have supported
Oh, that's
it.
absolutely wonderful.
Right.
That's wonderful.
Can you tell us a little bit about Bumps?
Oh, Bumps, yes.
Are you still affiliated
Yes,
with Bumps?
Bumps is an organization that was started by a former patient of mine when I practiced in Florida, who decided that having a child, if you needed IVF, shouldn't be cost prohibitive. So if the website is yourbump.org, and it's a nonprofit organization that raises money and then
I love this.
has, we have patients apply, and based on, their need, their medical backgrounds, we determine if they are eligible for a grant under consideration. And there's an entire board, and the board gets together and we give grants for fertility treatment.
I love that.
Yeah, so do I.
love that. And you know what? Tell us about your awards. You are loaded with awards.
And don't be shy.
Don't be
be
shy.
shy.
Tell us everything. We want to know, and
Yes.
everybody's going to want to know.
Now, I think I received a teaching award or two in the past. I was chosen to be what's called a CREST Scholar a couple of years ago, which is a program that is geared towards making reproductive specialist scientists as well, because there is so much science in what we do, as you can see. And that was a grant given to me by the National Institutes of Health in conjunction with the American Society for Reproductive Medicine and Duke University. And that was a really, really good experience. But the thing I want to talk about, which isn't exactly an award, but something I'm doing very soon, near and dear to my heart, is my mission in the Philippines.
Oh, yes. You were telling us about
Talked
that.
about that a little bit.
Yeah.
So a close colleague and a close friend and colleague of mine from St. Barnabas is co-founder of an organization called Life is Great Global Foundation. And I'm going to read the mission statement because I think that this is really important. I think I forgot the mission statement. But basically what the foundation does is it provides, medical relief for people in need in various countries. And on the heels of the hurricane, the typhoon last month, we will be heading to the Philippines in February for 10 days to provide surgical services, medical services, clothing. I had a Christmas party on Friday night, and I had a clothing drive.
That is so wonderful.
Leave your cookies home. Bring a new item of clothing for someone in the Philippines. So that's
love
coming out.
See, we
love
love
this.
Dr. Keegan.
We
And
love
this
Dr.
is
Keegan, of
why,
course.
This is why.
LIGglobal.org. LIGglobal.org if you want.
LIGglobal.org, people, because, oh my God, what an amazing, amazing thing that you're all doing.
Yeah.
This is wonderful.
I think we're talking to an amazing woman.
Absolutely, we
Amazing
are.
doctor.
Well, that I knew.
Yeah.
I knew that the moment we met her.
Absolutely.
It was
Absolutely.
love at first sight, right?
Yeah, we had that whole screaming thing. Yeah, it was wonderful.
It was the hair and the nails.
Of course. That's what we did. Yeah. We just kind of all clicked. And the fact that we were actually the both, the brunettes in the little midst of blonde. Yeah, it was true. It was true. Anyway, so that was wonderful.
Absolutely.
And just wonderful to hear. Yeah. What else do you have to say?
Well, I want to thank you for joining us
Absolutely.
this morning. What an absolutely amazing, informative interview this has been.
Absolutely.
Yeah, yeah.
Well, it came from her.
Absolutely. And we are listening to Dr. Deborah Keegan of the Institute for Reproductive and Medical Science at 375 U.S. Highway 130.
I want to give the phone number this time.
Okay.
Okay. You can reach her at 609-448-4300. That's 609-448-4300. You'll be glad you did.
And that's,
And that's a wrap.
yes, that's a wrap. You are listening to Trend Radio, where we talk about what's hot and what's not. Get into the loop with us. I'm Anthony Vincent.
And I'm Elise. And remember, we're your radio gateway to what's trending with beauty, fashion, music, health, and wellness.
We'll see you next week. Next Saturday morning, every Saturday morning at 10 a.m., right here at 9:20 a.m. Trend Radio.
Bye for now.